thank you to everyone for coming. Thank you also to our partners and the World Economic Forum for hosting this. I think this is a great conversion in terms of public-private partnerships, both combining the diplomacy of our skills within GHD with the expertise of the World Economic Forum in terms of the private sector engagement. So thank you. We look forward to a very productive morning that has started bright and early. And we're going to be addressing how PPPs are important for the delivery of ambitious global health care goods. And we're going to look at what's necessary for globally in the new post-2015 agenda. The objective of the session is to facilitate the collaboration between the public and private sectors. So, some of you are diverse in your tables. I'm looking at the financing table. So you've been seated so you have both investment firms, civil society, private sector, and government. And so we look forward to this discussion. We'll begin with this panel session. And I want to turn it over to you.
Thank you. Thank you, Michel. How are you doing? Fine, and yourself? So, thank you very much. Indeed, John, I think the World Economic Forum pride itself to be a platform quite unique in terms of facilitating public-private partnerships. And this morning I would like to also use it as a call for action. I think the need for PPPs has never been more acute. And we can understand the four reasons why that is the case. I mean, if you think about what's happening along the continuum of care, there is hardly any stakeholder that can implement a complete solution that would be integrated. And when you think about the integration of clinical analytics, big data, genomics, and the different components and constituents that need to work together along the continuum of care, that's becoming very intricate, very complex, and requires all stakeholders to work together. The second point is there is definitely a shift of philosophy in the way public health is being regarded globally. In the past, in a way, there was the assumption that the private healthcare sector would be for the rich, and public health would be a duty from governments as they implement universal health coverage. And we are all in favor of universal health coverage, but we need to recognize that very often it's being complemented by the private sector as an additional leverage, additional coverage layer of safety net. And those systems need to work together, as well as research, that's the first point, as well as pricing, as well as regulation, and as well as everything that needs to happen that will align incentives. And Minister Sidibe, we discussed yesterday antimicrobial resistance. If there is one case today where the public and the private sector need to work together, this is definitely one. I think what needs to happen is there is the fourth point, and this is where we would like to spend quite some time together with the two opening panels and then in group table discussion is what are the business models that need to be invented so that each can gain and the risk-sharing models can be implemented. Because it's not rosy. We have only so many cases of PPPs that are working well, and one of the reasons is, again, from time to time, the disalignment of incentives, and also from time to time, a certain mistrust between the different constituents. And we should not ignore that as we move into table discussion. But with no further ado, I would like to ask Michel Sidibe, from Executive Director of UNAIDS, to start with keynote remarks.
And Michelle, one of the things I'd like to mention is UNAIDS has been a public-private partnership within itself. I mean, you really have truly mobilized the private sector in terms of all of the engagement in China and with the global leaders. If anyone, we asked you to keynote because of your diplomatic leadership, both with the private sector, but also with the heads of state around the world. So thank you.
Thank you very much, Joanne. It's always a pleasure to be in this early meeting. You're the only one who can convince all of us to be before the 7 o'clock. But I think the subject we are dealing with this morning is a certainly timely, and it's at the same time topical. Why is it timely? Because we are in a defining moment in the world today. We are really moving from this old paradigm where we were certainly defining development through the lens of Millennium Development Goals, which were very important. We were capable to certainly create a global accountability framework, making sure that people focus on areas and deliver on it, to SDGs, which is sustainable development. And if you talk about sustainable development, the paradigm is changing completely. It is not about mobilizing few resources from the north and make those resources available to the south and transform. Today, we are talking about trillions of dollars which will be needed like that from the north to the south. So, and the scope is completely different. We are talking about energy, we are talking about climate, we are talking about health, we are talking about so many different things. But it's important to take a few minutes to show already that we saw the sign of this transformation with HIV/AIDS. HIV/AIDS help us really to understand clearly that if it is not about public-private partnership, we will not be able to achieve the goals we are setting. And we would have never be where we are today. You have to remember, we're not talking about 100 years ago. We're talking about a few years back when we were sitting all together in the General Assembly room when people were saying we cannot give a medicine to poor people. They will never be able, first, to follow the protocols, but secondly, it's too expensive, and we were not even knowing which drugs to give. Because people were sick in the north, in the south, we didn't have a medicine, we didn't have nothing. And we didn't even know how to really deal with this epidemic. So I think private sector and the public-private partnership changed completely the paradigm. Change the paradigm because activism in science came, pharma helped us to produce the first drugs, and then we moved from 18 pills per day to 1 pill today. You could imagine without the innovation, without the creativity, without the engagement of the private business, how we would have been able to really dream that we'll move from 18 pills to 1 pill, and soon it will be probably 1 injection every four months. So that is the public-private partnership. But it's also very important for us to understand that they were not just providing health care services and drugs, research and development, helping us to invest in innovation and changing completely, but also in terms of thinking about how we deal with a disease in the future. How we will be starting to really provide services to people who are, like you were saying, it was bad and good. And I think this paradigm is obsolete. What we are talking about today is how we'll reach not only millions of people, but how we'll be able to reach billions of people with. Because when you start thinking about, all the non-communicable disease and others, we're not talking about the same scope. So we need to understand that this sustainable development goals is providing space which we cannot, is impossible for us to achieve those sustainable development goals without working with private sector in a different way and bringing private sector at the center of our partnership. I have Steph here, I think he's the best place to also tell us the experience of Ivy and others. Without those research, and we're talking about Ebola vaccine today, if we were not investing, we could not even dream to think about those. So for me, it's important. But let me say that It's good to say, let us look at how private-public partnership will work. If we don't address the governance issues, well, we will not be able, because what we are seeing today is the gap between private sector contribution to health and development in general and their participation in the global governance. In the global governance, you go in most of the places, including WHO. We are here for World Health Assembly, but you don't have space. You cannot be sitting around the table. You have a few organizations, Gavi and Global Fund, but they are not UN organization. Probably UNAIDS, where you have a civil society represented. But unless we address this serious gap, unless we are capable to say that it's not a crime to have a private sector sitting around the table, it is an added value to our global approach to really end the disease for poor people, we will have a problem. We will have a problem because in one side we are talking to ourselves, it's very incestuous, and other side we are trying to make sure that we build this bridge. So governance system, for me, we need to challenge the governance system. The current governance system is not working. It has been built 60 years back when the world was completely different, when the dynamic was different, when the issues we are addressing were completely different. So let us have the courage to say that this governance approach need to change. So, but also we have to reflect on the facts. Before coming here yesterday night, I was trying to just pick some data. I said that, but yes, you're going to speak to people who are more competent than you, but what you will tell them? So, but in reality, if you look at, you will find clearly that it's not, it's already a debate we should have 15, 20 years back, because ODA is the past. ODA is important. I don't say that you should not, but ODA cannot finance SDGs. It's impossible. Is a small portion of what the world will need. Really, it is not even equal to remittance fund. Remittance fund, which are transferred every year, is 3-4 times more than total ODA, which are transferred. So I was trying to look at. In the 60s, ODA was representing almost 70% of capital flows of developing countries. But that dropped to 13%, 13%. But at the same time, the private finance make up the bulk of foreign direct investment today, which was representing around 500 billion. I said 500 billion in 2011. So how we will tap on this? How we will really understand that it's not just about some groups doing some business here and others, but it's also a huge resources which are being invested in the development arena. It could be energy, it could be health, it could be whatever you want. So for me, it's the same. If you take, it's similar. When you take, for example, global health arena, the picture is similar. Overall spending on health exceed 6.5, let us say 7 billion. Trillion in just 2 years back. And the development assistance was below 35 billion. So we need really to think about how we create a new partnership, how we define this partnership, how we make sure that we align not just the resources of private sector, but their expertise could be transformative for the development. But that doesn't mean the normative function of state should disappear. That doesn't mean that the state should not continue to organize and put an environment where the public goods debate for poor people will continue to exist. It's not some contradictory to believe that private, and AIDS has been able to demonstrate that, because $80, it was $15,000 a few years back, the price of medicine. Today we're talking about $80. So it became truly a public good, but it didn't come from government. I remember my sister is here challenging the president of South Africa on price of medicine, and saying that it was 53% more expensive than other countries. They have been able to negotiate, reopen the tendering system, work with the private sector, and reduce the price by 53%, and increase the number of people on treatment. So it's not contradictory. It is something we need to really help to create this environment, and for me that is what I think is so key for us to do. But the transition from MDGs to SDGs is also an opportunity. It is not just a challenge for all of us. I consider that as a huge opportunity for a private-public partnership. The model of development like cooperation will be completely different. We will see a profound shift on those models from traditional donor-recipient approach to more true partnership. And this donor-recipient approach, where it was from someone was a money and someone was a problem, will change, because most of those countries today are emerging. We will have almost 30 of those countries will be graduated to become middle-income countries. They are producing also growth now, and they are struggling to redistribute those growth and have a quality, but that will change. I'm convinced it will change. And that will create a different paradigm. UN cannot be the traditional UN and think that it will be just bilateral. No, it will be creating space for private. And I'm seeing that already in many places where people are shifting and sharing. And the whole debate on commodity security, I'm talking about that every single places. You heard me. It will be a serious problem. If and how we'll be able to secure medicine to people? How? If we don't have really investment on research and development, innovation. Yesterday you were talking about when we had a lunch with Chancellor Merkel. He was talking about antibiotic resistance and how. So we will do that. Innovation will not come from a government. That is over, it's finished. Innovation will come from private sector, private investment. So the commodity security could be vaccine, it could be drugs for whatever, it could be a new drugs to secure our health will depend of this partnership. So for me, I don't want to take too much of your time. The last piece I want to talk about it is that the reality will have less and less money coming from a traditional channel, and we will need necessarily to think about efficiency in allocation of existing resources and efficiency in implementation. And those two efficiency, private sector can help a lot to make sure that we reach more people with less resources, that we allocate better our resources where problems are, by trying to build a true relationship with government and others. And finally, I'm seeing this change happening in different places. Is I think you can talk about certainly the trust fund in SADC and private sector coming, ministers. I was with the minister of Tanzania yesterday night and others. They're all talking about, and we're in the ambassador of US a place with 10 ministers for the dinner, but all of them are talking about this new paradigm, but they're struggling. They don't know how to really make it real, how to work out a new type of relationship which will help to take us to the next generation of our partnership. Thank you very much.
Thank you. Thank you, Michel. Thank you so much. One of the things, quickly, I think in terms of financing and to our larger audience, that's our online live stream audience, Michel, to your comments, you've seen a transformation in financing. We're talking about a global funding facility between the governments of Norway, the US, Canada, the involvement of a private sector. It's truly what, you said, it's a restructuring of the governance, the global governance process, and how we deliver sustainable development. You have also the SADC Trust Health Fund. How innovative. I mean, having the ministers, own their own financial space within their countries. And then you have investment firms. You have donor countries that are investing in investment firms. One such firm, got an investment from a donor country for $2 million. Within 2 years, they turned it into $100 million, and it was all for health. So really, we're looking at a new world, and I think we have to challenge ourselves here within this discussion to really move to action. I know UNAIDS really has moved to action within the private sector, and so hopefully within this conversation, within your partnerships around the table, try to find ways where you can work together to mobilize in terms of next steps. So thank you. And with that, we will move on to our first panel.
Thank you very much. Thanks.
So if we could ask the panelists for the first panel to take their seats. Thank you.